I think there is a caveat to that question, and it's understanding the theme of evidence-based treatment that we follow here at Rogers Behavioral Health. The two evidence-based treatments that have been proven effective for the condition of OCD are cognitive behavioral therapy, which includes what we talked about, exposure and ritual or response prevention, and SSRI medications. So if an SSRI medication is not working for a patient, it could be dose, it could be duration, it could be some aspect to the use of the medicine or the prescription of the medicine, but it also could be the fact that they're not engaging in the appropriate cognitive behavioral therapy. I think inherent in appropriate treatment for patients is to first assure that they're getting the right therapy. If a patient is relying only on a medication to treat their condition, they're most likely not going to get the response that they want, and they're not going to get the best treatment. They're not going to get adequate treatment. So in answering that question, I think first we have to assure that the patient's getting adequate treatment and they're working with a therapist that knows how to do cognitive behavioral therapy and exposure and ritual prevention accurately for their condition. Then the medication needs to be prescribed accurately, and the two things you hear typically are dose and duration. The dose of the SSRIs that are FDA approved for medication have a range, and typically for OCD, we're looking at the top of that range. So you want to get to those stronger doses typically for OCD. What about the condition? What about anxiety demands those stronger doses? I don't know if we entirely understand that, but typically you're looking at the stronger doses and the upper limit of that FDA approved range. There are different schools of thought on that. Some evidence would suggest that the different ranges of the medication ultimately are equally effective in treating OCD. I think experience would point us to the opposite, though. Typically, people do best when they're on an adequate and strong enough dose of the medication, typically the upper limit of what the FDA would recommend, and adequate and appropriate exposure and response prevention therapy.